And we are live. Good morning, everybody. It's Friday. I hope you had a great week. I know I sure did out here in beautiful Colorado. As is often the case here this time of year in Colorado, we go from one thing to another, Jose. It's 60 degrees and then it snows. And so right now we're on yeah, it's crazy. We're on the tail end of some snow. Today is going to be in the 40s or so, and then over the weekend it's going to be in the 60s, and then around midweek or so next week they're saying more snow. And that's what's kind of nice about here is it snows and it melts, and it snows and it melts, and it doesn't accumulate, right? So when we lived in Buffalo, New York, right, it was just the snow just keeps going and it doesn't stop all winter. So that's always interesting for sure. But to get started here, my name is Bryan Armentrout, and I'm the founder of the Food Leadership Group and the Food Safety Foundation. And you have found Food Safety Chat Live. And we do this every Friday on YouTube, Facebook, and LinkedIn. And we talk about all things food safety. And if you're new to the program, what you'll notice is this is not a presentation. This is simply our opinions on different subjects, and I'm able to bring in experts and amazing people like Jose. And we talk about the concepts of the day around food safety, because there's one thing that's very true, and you'll hear this time and time again from us, is that food safety is not a point of competition, right? We're all in this together. If one industry suffers from food safety issues in the mind of the public, we're all the same, right? So we have to work together to make sure that food safety is working properly, and that industry and regulatory and all the other groups who support food safety understand that and are able to communicate that to the public. And so this week, I'm very pleased again to have my good friend Jose Sabal on the line. And so how's your day going so far, Jose?
No complaints. This is my third day waking up at 4 something in the morning because I was teaching a class, a course that I developed as a joint venture with an technological institution in Valencia, in Spain. Mm. And the thing is that, 5 in the morning for me, it's 11 in the morning for them. So, oh my goodness, third day, waking up at that time is rough.
Oh yeah.
But I made it, I guess.
And well, definitely. And you see Jose's email on here with his food company, Sabal Food Safety Company, FSC.com. If you're thinking about doing any training, Jose, he doesn't like it when I do this because he gets embarrassed, but Jose is one of the best trainers out there I know. He's amazing. His energy is off the charts. And whenever people evaluate his classes, he's 5 stars all the way. So if you need some training, definitely look up Jose. So one of the things, guys, that we love to do here in the morning is say hello to everybody and have a conversation, right? So as we're talking about our topics today, interact and put your comments in there. If you have questions, we'll keep an eye on the comments here, and we'll try and work those into the conversation as we can. There's sometimes a delay and sometimes connection issues and things like that. So if we don't see your thing right away, please let us know. My assistant Renee is on as well, and he helps to monitor these as well. So I hope your day is going well as well, Renee. And we like to say hello to everybody, and we see a lot of the same faces here on Fridays, and we really appreciate it, right? Because we do this for you, and food safety, as we said, is for everybody. So make sure and contribute. So Alba's here this morning. Thank you for joining us. And Francisco, always good to see his nice face. Austin is here. And Austin has an amazing company, Sage Media, and he's going to be maybe a little embarrassed by me sharing this. But too bad, Austin. He sent me a video. He's an amazing guitar player. And he sent me a video. He's working on different solos, and he did the Joe Walsh solo from an Eagles song, and he sent it over to me, and it was stunning, absolutely stunning. So amazing talent there. Duncan's here, good to see you, and of course Bryan Ravitch was on recently out in San Diego. Bryan, of course, was with FDA before and is an amazing resource on foreign supplier verification. So if you can't tell, right, we've got some amazing talent in this group who join us. So thank you, everyone. Martin is here. Always good to see you down in Phoenix. And Tia, of course. Good to see you, Tia. Hopefully Joe will join us as well. Musa, a new face. Welcome. Glad you're here. So Jill is here as well. Good to see you, Jill. I love her picture there in her profile, a nice smiling picture. So one of the things before we dive into the topic here that I would love to mention as well is EAS Consulting Group is our sponsor for this food safety chat, and we got their little logo up here. Yeah, I'm getting better at that. So if you're looking at some training as well, EAS has amazing resources. They have training, they have consultants and other people. I work with EAS and do work through them. If you're thinking about some training, go to easconsultinggroup.com/training and check out their programs. If there's something that you need specialized, they can develop those for you as well. And if you find a course that you like and you put Bryan with a Y in the checkout, you'll get an extra 15% off. It's just amazing. So thank you to EAS for that. Good morning, Jose. Good morning, Renee. Wow, we got an amazing crowd here today. Mark, good to see you. Ooh, out in Oregon. I actually went to kindergarten in Oregon, believe it or not, when I was a little kid. And my dad didn't like the rainy weather, so he moved to Wyoming. So I grew up in Wyoming. So today's an interesting topic for sure. So before we dive into that, though, get our drinks.
We're going to get these.
Absolutely. Everybody, please, wherever you're at, raise a beverage with us and join us for our morning drink. Was that just water, Jose?
I'm having water. I already drank 1 coffee and 3 teas. You can imagine, from 4:30 in the morning.
Yeah, I would say so. I don't, yeah.
So it's time for water.
And Renee put in the code for the discount at EAS. Thank you, Renee. Renee is awesome. So one of the things, Jose, that is very important if you're working in food safety is trying to get into the mind of regulatory agencies. And what are they thinking? And what are they worried about? And what are those priorities that they're putting in place for 2022? And FDA gifted us a little list here recently of things that they are working on and their priority projects for 2022. So Jose and I figured this would be a great time to kind of go through these and kind of put on our thinking caps and our little mystical, like Johnny Carson used to do. And what was that? Karnak. That's right. The amazing Karnak, where he used to guess things. And we'll try and guess as to what we think FDA is thinking in these areas, right? Because sometimes they let you know, sometimes they don't. So with this list, and there's 30 items, right? So this is a big list that these guys are working on. And so what we wanted to do is kind of go through these different items. And if you like this list, please, you see our emails on here. Let us know. We're happy to send you the list. And let Renee know as well. Renee can send you the list too. So we might as well start at the top of the list here, Jose. So the first one on the list was evaluating the public health importance of food allergens other than the major food allergens defined in the FDC Act. Interesting, right? So of course, sesame's coming, right? Pretty quickly too. And other countries around the world have other allergens that they're concerned about that we don't have in the US, right? So of course we have the big 8, soon to be the big 9. Yes. Now FDA is doing additional work on additional allergens. Interesting. So they're trying to figure out how big a threat these are. So some examples out there of different allergens that can be a potential concern is lupins, right, which is kind of it's a legume. Buckwheat, celery. I've heard celery, right? So celery's right kind of at the top. Mollusks. So they're breaking out mollusks from other shellfish. So looking at that as a subcategory. And mustard. I've seen mustard too. I think mustard is Canada, right? I think mustard is Canada.
Yeah, and Europe too.
Oh, excuse me. And the other one that people I think get confused about too a lot of times in food safety is gluten, right? So
we need a conversation about that because Bryan, wheat is wheat, and wheat is going to cause an allergic reaction from the body. Now, gluten is a different disease. Now, is that coming also when you're eating the wheat? Yes, but those are 2 different diseases, and we need to understand this.
Yeah, absolutely. And I've had complaints when I was working in industry where people would say, I have a gluten intolerance, I'm celiac or things of this nature, and I had an allergic reaction to your product for gluten, right? Well, that's not an allergic reaction, right? It's an intolerance. That's a
That's
mechanism of the
intolerance.
disease, right?
Yes.
So if you're celiac, you have issues in your digestive process where that
Yes.
causes bad reactions, but that's not an allergenic reaction. So I
Yeah.
think it's very interesting that FDA has lumped that in with the other allergens.
Well, I mean, I'm going to guess, and now that they are talking about wheat as a cause for an allergenic reaction,
Huh?
it is possible that at the same time, because people is already consuming wheat, sometimes instead of getting an allergic reaction, you're going to get a problem with your digestive system, and because you are celiac or something like that, and just mentioning that,
Mhm.
I guess is my take. Regarding your comment, Bryan, about why analyzing other allergens. If you read the Food Allergen Labeling and Consumer Protection Act of 2004, where originally the AB gate were identified, and the reason why they need to be identified in the label was because 90% of all of the visits to hospitals are because of those 8.
Yeah.
Okay, so it is very amazing to see that the FDA is studying the others, because
Mhm.
the others may not fit into the 90%, but eventually they might be, I don't know, 70%, 75%.
Mhm. Well, what's interesting too is what's not on here. So from my perspective, and this is me on my soapbox, is they should look at taking coconut off the list.
I believe so. I mean, hold on. Is it possible that we have people that is allergic to coconut? Of course, yes.
Yes.
Now, does that mean that they are 90% of the visit to hospitals? I will say no.
And my understanding is that, yeah, the coconut data is very limited. There were a few cases that could have potentially involved coconut, but nothing was ever linked. And I'm not aware of anybody getting ill because of an allergic reaction to coconut. Now, maybe if somebody in our audience is, let us know. But I am not aware of that. Let's see. Alba had a good question here. Do you have the latest U.S. list by the FDA on allergens? I assume, right? So I'll put this here in the comment section, a fantastic resource for allergens is FARP,
Oh, yes.
FAARP at the University of Nebraska. And
Yeah.
these guys do an amazing, they're pretty much the go-to resource for allergens.
Yeah.
And they actually have a very nice book on their site that you can get from them on good practices in your facilities for allergen control. So definitely check out FARP. There, if you're a larger company and you have the resources, you can become a member and help support them. But they're super awesome, right? They're a good organization. So, right, the latest list, right, the big 8 haven't changed. So, like, do we want to list them off? Do we want to do a test on that? Embarrass ourselves? No, not going to do it. So definitely around that side, take a look at those and see what's going on that side. Let's see here. Whoop, where my comments go? There we go. So Jill had a comment here. I studied allergens in grad school. The list has a lot of allergens the UK already recognizes on their labels. Yeah, celery is the most surprising for me. And definitely, if you're working for an international company, you come across this, right? So if you're dealing with Unilever or things like this, they're already requiring you to disclose on these type of things.
Yes.
But again, remember, from a food safety standpoint, the top 3 categories for recalls pretty much doesn't change it, right? It is pathogens. So Salmonella and Listeria always lead the list there.
Yeah.
Foreign material, right? And I love beating on the foreign material because half of all foreign material complaints are non-metal, right? So
Yep.
don't forget that. And of course, number 3, allergens, right? Allergens.
Yes.
And it's my contention, to your point, Jose, on the labeling and things of this nature, that it's not sanitation failures that cause those recalls, it's labeling failures.
Well, I mean, it depends on the production, Bryan. If you have a facility that, for example, I have a client, all of their products have wheat and soy, all of them. And the products are a little bit different, but all of them contain the same thing. Are they concerned about having mislabeling issues? No. All of the products are going to have. they may put the chocolate flavor into the strawberry flavor, and well, okay, it's a labeling issue. Yeah, is the product adulterated because it's misbranded? Yes, 100%. But does that mean that that is going to cause an allergic reaction on someone? No, because the allergens are the same. Now, in a different bakery where they may use different allergens for different products, oh, that is another thing that we need to consider.
Right.
Labeling for sure is an issue, and according to the class, according to the training, 26% of all of the allergen recalls is because the label is not the right one. So it is significant.
Right.
Now, I believe that the second one is cleaning and sanitation.
Yeah, but I would guess, right?
Yeah.
And it's just me guessing, right? Is that's pretty far down the list. Now, to your point, I totally agree, right? If you've got the same allergen in the plant and you don't change it, yeah, you're great, right? But if you're switching, that's when things happen, right? Packaging gets left in machines, labels don't get updated correctly, et cetera, et cetera. And the point I always make with leadership when I talk about these things is when you add in additional allergens. So let's say you're a plant that has dairy and you're adding in soy. Right? It's often viewed within companies, oh, it's not that big a deal. We have allergens. We know how to control allergens. And now we just added another allergen and it's this plus this. And I'm like, no, this is not an additive risk. This is a multiplicative risk. Right?
Yes.
There's a curve that goes like this because the more complexity you add, the greater your chances of having mistakes, right? It's so easy to mess up along the entire way. So pay close attention to those, please.
And we have Christopher saying that some companies just put they may contain allergens as a catch-all. And maybe yes, but one thing that I know for sure is that when I'm teaching the preventive controls, there is a slide there when the FDA says, be careful. I mean, you may use the may contain as long as all of your prerequisite programs are working well and there is no contamination of the product, cross contact between allergens due to a lack of effectiveness in the prerequisite programs. And we're talking basically about the cleaning and sanitation.
Well, and FDA has commented on that because, I mean, that's exactly right. Originally on, the lawyers got involved and said, just put every allergen on the label. And then all of a sudden people couldn't eat any food who were allergic to things.
Yeah.
And FDA came out and said, listen, guys, your lack of good programs is not an excuse for putting allergens on the label, right?
Yeah.
And they've said, there's situations where if you have one line crosses over another line and these type of things, and the cross contamination is unavoidable, then yes. But if you're putting on the label just because you don't do a good job of cleaning or other activities,
not acceptable.
Not acceptable.
Yep.
Absolutely. So let's see here. Shay is allergic to garlic. Isn't that interesting?
Wow, that's amazing.
That is. Well, I mean, that's part of this too, right? It's absolutely amazing, the immune system, the ability of our bodies to decide what's us and not us, right? Because even in our existence, when you're perfectly healthy, a big chunk of who we are is not us, right? Yeah. All the bacteria on our skin and in our guts and everything else, it's not us. I think I read somewhere there's more foreign cells associated with us than there are our cells.
I heard that too. Yep.
Yeah. So it's crazy, right, that our body's able to do that. Jill says, I had a girl at the yoga facility that had an allergic reaction to coconut when she was working. Wow. Very interesting. See, I was proven wrong already.
Okay.
And so, Jennifer goes to FARP as well, definitely. And Mark, when I was a QA director at So Delicious, we had many customers that had allergic reaction to coconuts. Okay, well, I'm getting hammered now. Sorry, I'm gonna have to take back my coconut comment.
No. I mean, coconut is an allergy for certain people. I mean, the point, Bryan, when we were discussing the issue about coconut, is that are people visiting hospitals 90% of the visit, and coconut was one of the allergens identified during those visits? That's my question, because that is what was used in order to determine which are the big 8 originally.
Yeah. Well, I think politically this shows a point too, right? It's not advantageous for a regulatory agency to remove things because what happens if something goes wrong, right?
Yeah.
So FDA watches this and said, hey, Bryan's right. Let's take coconut off the list. And then people come forward and say, oh my God, what are you doing? I got sick from coconut. What's wrong with you, FDA? Right. And then FDA is in a touchy situation politically. They don't have to be in. So why do it?
I mean, Bryan, as easy as publishing the data from visit to the hospital with an allergic reaction. What was the source of this one? Wheat, and that one milk, and that one eggs, and whatever is the percentage, at some point you're going to see coconut, but most likely it's not going to be something relevant.
Yeah, absolutely. So Tim has a severe shellfish allergy. I won't eat if it's made in a plant where my product is made. I've seen too many times where that's a CYA. Right. Absolutely. Absolutely. And I mean, shellfish allergy's got to be tough, right? Because if you're in a restaurant,
yes,
in the back of the house, right, they're cooking a variety of different dishes and using the same pots and pans. It's got to be a hard thing to deal with. That's for sure. So here's Duncan has a friend who's allergic to pineapple. And if you look at the Japanese, they control for kiwi. Wow. Look at that.
Wow. Yeah.
Wow, this is really cool. I love this. Thanks for the input, guys. This is awesome. So Jill worked at a yogurt facility that had an allergen filter. At every run, we would switch to another allergen. We had to clean and test every surface for allergens. Yep.
Great.
Verification. FDA loves that.
Yep.
What do you think about adding sulfur dioxide and sulfites to the list? They're in the UK 14 allergen list. Well, now let's see. So for sulfites, you have to declare over a certain level, right?
Yep.
10 ppms? I'm guessing.
Sulfites. Below 10, you don't need to declare. Above 10, you need to declare. And I believe that is between 10 and 100, because remember that the FDA is that we need to prove that there is a functional reason why we're adding that to the food.
Absolutely. Yeah, you just can't throw it in there. And let's see here. So let me look up on foodindustrycouncil.com, which if you haven't been there, has an amazing resource for recalls. So it's searchable, which unlike the FDA website is not. I'm looking for recalls for sulfites.
Oh my goodness. You are going to find there, Bryan, for example, a lot of dried fruits, wine. What else? What was the other one that is big?
Yeah, you're right. Those are the big ones.
Yep.
It's not pulling up right now for some reason. All right, we'll come back to that. We got lots of other things to talk about. We're only on number one. All right, so number 2, questions and answers. So this is FDA again wanting to put together a document. Questions and answers regarding food allergens, including the labeling, right? So that kind of falls in with that. So FDA hasn't updated that since 2004, when the last round of legal labeling changes took place, right? That's what we were just talking about, right? Which is labeling with common names, right? So if you're using caseinates from milk in your product, you can't say caseinates without identifying that, hey, if you have a milk allergy, this is milk, right?
Yes.
Because again, it's the proteins that people are reacting to.
Yep.
And so that's that one. So then they have a couple on dietary supplements, and that's a little outside of our realm. But definitely the reason I thought it was interesting was that I think FDA is really starting to focus in on dietary supplements and what's being done in that area, what type of claims are being made, what type of ingredients are being used. And so in these two requirements from FDA for these documents they're going to be creating is really around notification procedures. So if you're looking to add something for your dietary supplements, there's a process you need to go through to let FDA know about that. You just can't, throw it in there like a crazy man.
Yeah, and I would like to say, Bryan, in the specific case for dietary supplements, that we need to remember that according to the definition in the law, dietary supplements are food.
Yes.
They are not, because, a lot of people think that, I'm producing some dietary supplements. So the regulation for food is not, applying to me, and I say, no. Dietary supplements in the United States, according to the definition in the law, are food.
Right, you're eating them.
Yep.
Makes sense. Well, now you also have medical food too, right?
So and we have
this kind of this blur between these different things.
Yes.
Pedro had a good comment here, right? So allergens become more complicated when you look at tendencies within groups, right? So he's pointing out here that in Mexico, there's a tendency for people to be allergic to strawberries, apples, and chocolate. Wow. I didn't know that.
Wow, that's amazing. Pedro, gracias. Thank you for sharing.
Yes, that's very interesting. Thank you. So dietary supplements, and then a couple on food additives. So best practices for convening a GRAS panel, guidance for industry. And so GRAS, of course, is generally regarded as safe. So these are things in the marketplace where you submit information to FDA and say, hey, listen, this has been used forever. All right. Therefore, it's safe, right? That's me with a really horrible summary of GRAS. So let's say salt, right? So, hey, FDA, right? We want to recognize salt as generally regarded as safe. And then FDA would go through a process and say yes. Now, I think this is on this list again, and this is me trying to get inside the brains of FDA. FDA is taking some heat over GRAS in the past couple of years, where there have been submissions and approvals, and people came back and said, wait, what? That's not safe. How do you know that's safe, right? And people have actually challenged some of the GRAS submissions and approvals from FDA. So I think FDA is trying to tighten that up.
I mean, I'm just going to say, Bryan, recently, because this is recent, in Europe, titanium dioxide was removed from the list of acceptable additive to food.
Yeah.
Okay. My point, and this is a generic approach because there is not that much that we can do here, but as a general approach, I mean, is it possible that we may need to add to help us with the flavor, with the texture, with the smell, with I don't know, the way that it raises, or with the colors, or so on, which is a functional characteristic of the food? Yes, we can add a lot of things. Now, does that mean that it's safe for eating? That's what requires studies. And some of these studies, exactly the same thing that we're going through with the virus, with the pandemic, they need data. So we need consumption data, and years and years and years and years of studying and looking at consequences in order to make an educated decision and say, well, you know what? Yeah, we originally approved this to be used in food, but guess what? Right now, we have enough evidence to remove it from the list of normally substances normally recognized as safe.
Right. And yeah, so for people who don't know, right, titanium dioxide is a whitener, right? And so
Yes.
you put it in toothpaste and things like this to make it nice and white. And yeah, it's been used a long time. Now, I think this is also a good example, Jose, of how testing has improved too, right? So we see every year the list of like USDA where they do pesticide testing in fruits and these type of things to see what type of things are out there. And every year the tests get better and better and better, right? So we used to talk about, when we were younger, about parts per million for contaminants in products. Now it's very common to talk about parts per billion, right? A 1,000-fold increase.
Yes.
And they start seeing things, right? So it was 0 parts per million, and all of a sudden you've got 5 parts per billion. Okay. Was it there before? Probably. You just couldn't see it. The tests couldn't detect it. It didn't suddenly appear. Is it now really a threat? Right. So that's kind of what toxicologists and all these people try and work through to figure these things out. And looking at, to your point, which is 100% true, is large crowds, right? So you need a large volume of data to look at these, from a cultural standpoint by Mexico or what have you, and the populations to see if there's actions that need to be taken in those areas. It's very complicated.
I was reading Austin comment. And you know what, Austin? It's not just what you are, the observation that you are making there. Let me give you another one that it's pretty much what you are describing there. Anyone that is receiving corn for the manufacture of biofuels, and then you have the still dry grains that are going to be used as an ingredient mostly for pets. Well, if you have mycotoxin there, most likely it's going to be aflatoxin in the case of the corn. And that corn go through the process of the biofuel, the temperatures there are going to increase the potency and the concentration of that mycotoxin. So I agree with you 100%. The process. Actually, acrylamide how acrylamide is formed? Well, you need temperature and you need the sugars of
Mhm.
certain products, and that combination with the temperature, well, now you have the acrylamide. It's part of the process.
Right. Well, and that's a good example too, because things like that have a drastic impact on the food chain, right?
Yeah,
Because French fries, right? Acrylamides, potato chips, right? Any type of a carbohydrate-based item that is fried has a potential for acrylamides, right? So figuring out if that's a risk or not
yeah.
is huge. Um, so that's good. So Musa asked the question: is there a distinct difference between allergens and sensitizers?
I'm not sure if there will be a distinct difference. I will concentrate, Musa, more on the effect, because our concern in the food industry is to prevent anything that will, as a general approach, adulterate the product.
Mhm.
But very, very important is anything that will cause illness or injury right now, immediately, or long term.
Yeah. Yep. I think it's, yeah. So it's more one of degree than anything
Yeah.
else. Yeah. And definitely check out for more information on that. But the difference between those, check out FARP. They've got lots of good information. I'll kick the football to FARP. Um, let's see. So Duncan listed a list here. So he put in a Wikipedia, an allergen, a different mechanism at play. So thanks, Duncan, for that. Appreciate that. And let's see. So here's something. So under the food additives as well, and this caught my eye, number 7, is pre-market consultation on cultured animal cell foods, draft guidance for industry, right? We're seeing tons and tons of activity in this space right now where people are creating cultured seafood, where they're able to grow the cells and put together a fish fillet, which is amazing, right? Imagine being a vegan, right? So now you're in an interesting place, right? So, okay, I don't want to kill animals. Okay, well, no animals died.
Yep.
Could be an awesome solution for those guys. But again, it's no man's land, right? So within our regulatory framework, they only look at food, right? It's like, okay, here's a cow, turns into this. Here's a fish,
Yes.
turns into that. Now you've got these technologies and you have these substitutes, right? So, like imitation meat and things like this.
Yep.
And I remember back at White Wave, the big fights in the industry around what's milk, right? So you
Yep.
see soy milk.
Yep.
What's milk, right? Soy milk is not a product of a cow or other animal, right? It's from a plant.
Yes.
Can you call it milk, right? And the dairy industry and the traditional people in those spaces were like, hey, you can't call this milk.
Yeah.
And all kinds of fights developed out of that, right? And it kind of settled
Yeah.
down where those guys won, right? So it's going to be very interesting to see how the cultured animal side of things looks at that.
And not just that, Bryan, any other, oh my goodness, any other thing, I'm going to say any other food that is manufactured by going through bioengineering. I'm
Yeah,
currently helping a company and they're producing myoglobin, which is the component in the meat that provides the flavor. And now you can grab a, veggie patty, add this flavor, and now you have meat.
crazy. I mean,
Amazing.
we're living
Amazing.
in interesting times, that's for sure.
Yes.
And now look at this from a food safety standpoint, right? Because this is the food safety chat. How do you then begin evaluating the hazards with that from a physical, chemical,
Oh
and
my
microbiological
goodness.
hazard?
I'm already going through the challenge, huge challenge.
Oh my goodness. And what type of long-term data in there is? What type of research do you have where you can look at the threats
Yes.
associated with this?
Yes.
Probably not a whole lot. So you have
Yeah.
to be very careful.
Yeah.
And let's see. So number 8, foods derived from plants produced using genome editing. Draft guidance for industry, right? Again.
Okay. There you go. How about in the same order?
Yep. And so of this list of 30 things, Jose, 10 of these items are food safety and FSMA.
Oh, I have I grabbed that list, Bryan,
Yes.
and I group all the categories. Okay, I made an Excel spreadsheet with all the categories, and then I count them. How many guidance documents were developed for each of the categories? And we have 33% of all of the guidance was for FSMA.
Mhm.
30% was for food safety, and 7% was for allergens. So between allergens, food safety, and FISMA is 70% of all of the guidance document developed by the FDA this year.
Yep. So again, right back to the topic for our chat today, what's on FDA's mind? What do they consider the highest priorities?
There you go.
Food safety. And moving on with that great observation is 9, 10, and 11 is action levels for lead in juice, inorganic arsenic in apple juice, and lead in food intended for babies, draft guidance for industries for those type of things.
Yep.
These type of levels within food is a very confusing thing when you're doing the hazard assessments, because those regulations derive from EPA rules around water, and it hasn't been clear of what the correct level is. And so as referenced in here with the action levels for arsenic, right, they're talking about inorganic arsenic. And so one of the things you find out when you start dealing with fruits and things like this is that there's organic and inorganic sources for arsenic. One is not too good and the other one is okay, right? So it's good that FDA is starting to clarify around those points, because that's an important part of your hazard analysis.
Yes.
Figuring out from a chemical standpoint, if you're buying things that have the potential for heavy metal contamination, how are you dealing with that and how are you measuring that? And what is the defect action level you should consider? And it's been very vague. So I'm glad that FDA is working on that. And I think part of this too, right, is pressure from the outside world, right? So Consumer Reports, for example, has gone out and taken products from the market and tested independently, right? And they tested a lot of baby food and found this arsenic. And the industry, of course, doesn't like that, and they need to correct that. And of course, FDA then is embarrassed by that as well too. So I think it's a good example of private organizations, helping to push these things forward. Francisco has a question here for us. What is your take on plant-based protein being a trigger for immune response based on the modification of protein structures and higher concentrations of these proteins?
Oh my goodness, that question is great. I have no clue, but the question is great.
It is. Well, and I think, right, that's an important part of being a successful food safety professional, is being able to say, I don't know, right? Let's figure out what that is, right? Because we do have some information that we do know, right? Allergic reactions and these type of activities come from proteins, right? Reactions to proteins. So if you tweak and modify those proteins, are you reducing the risk or are you increasing the risk? Hard to tell.
Hard to tell.
And let's see. So James has a question. Thank you, James. Other than FDA guidance docs, is there any other comprehensive raw material risk assessment documents out there? If you haven't been as lucky as myself and worked for some of the largest food companies, what would be a good source to back up your raw material hazard analysis in your HACCP studies?
Oh my goodness. That's, well, I mean, we know that we can certainly use information from universities that they provide outreach and help people, that's one source for sure. The other one I'm going to say right now, FSPCA, because they are working with the FDA now in the implementation of the FISMA rules, 100%. I will say also, James, the Association of Food and Drug Officials. I will say that in Oregon University, they are now managing the list server for food safety. And yes, is a lot focused on seafood, but they have very, very good information.
Well, Duncan's awesome. He's putting all kinds of good information in here. Thank you, Duncan. So a food portal for the UK, and I'm trying to look at the link here, chemical contaminants, etc. So one of the important things, and people get dinged on this for their food safety plans, and this is something when I help people create food safety plans that I do, is I create a listing at the end of all the reference materials, hyperlinks, and these type of things to reference sources that I use to create that food safety plan. Because I'm sure you've seen this too, Jose, is people get hit on this because FDA will come in and look at a food safety plan and you'll identify risks. It's like, okay,
what was the source?
We have salmonella is a risk for chocolate. Okay, how do you know that?
Yep.
And people are like,
yep.
Right. And a little trick that I do on this too, a little tip, is anytime I can, I always use FDA reference material. So
Yeah.
Microbiology, the Bad Bug Book, things like this.
Yes.
Because it's very hard for FDA to argue against their own information.
It's certainly.
Right?
Yeah.
And so there's some great information out there. Don't forget to put that reference material, these sources that Duncan is putting in here and things like this, and using experts like ourselves to help you build those things out, because FDA is asking that question more and more. How do you justify this decision? And we've seen this in some other points in here.
Regarding Duncan's comment, yes, the European regulation, which is the link that I can see there, is one. But you can use also Codex Alimentarius. All of the standards for manufacturing food are there. And actually, they do have more standards than the FDA, by the way.
True.
Okay. Another good source will be the FAO and World Health Organization and the Food Agriculture Organization. Those are very good sources of information.
Right. So you have to document. You have to document your sources.
Yes.
So what's kind of interesting here on the food safety side too is FDA under 13 and 14 and 15 is calling out issues that they've recently had in the industry for recalls. So salmonella in shell eggs, helping industry with that, questions and answers. Yeah. Reducing the food safety risk from seeds from sprouting, right? How many recalls have we seen for that, right? Recently, one that's caught my attention for a lot of recalls too is enoki mushrooms. Holy moly, there's a lot of recalls for this.
I saw it.
It's like, I'm not eating those anymore. No, thank you. And then the third one was this one. This one I find very interesting too. Then Jose is number 15 is Listeria monocytogenes in human food, draft guidance for FDA staff.
Yep. I'm wondering if that guidance document is going to be available for the public.
I hope so.
Hopefully, yes.
Right. And this really caught my attention, right? Because this is something, if you watch this show, this is something that you're already aware of, is the IOM, the Inspector's Operational Manual for FDA. They updated that in 2021. And in Chapter 4, they go into great detail on environmental monitoring.
Yeah.
And Listeria and looking at contact surfaces.
Yep.
This, I think, right, and again, this is me guessing, is FDA furthering that knowledge base for their investigators in the field.
Yes, so actually, it's a section, what was that? The 4777, if right. I'm not wrong.
Yep, page 4-25.
There you go.
Let's see here. So number 17, CGMPs, current good manufacturing practices and preventive controls for foreign supplier verification. The number one thing by far in 2020 with 500 observations from FDA was foreign supplier issues, right? We talked about this with Bryan Ravitch recently, who used to work for FDA. FDA is cracking down. I don't know about cracking. I don't know, that's kind of a strong term, but FDA is really looking at foreign supplier verification.
Yes.
And Bryan told me something, Jose, that I didn't know, which was FDA is doing a lot of these reviews for FSVP remotely.
Oh yeah, I know that.
Yeah, well, you know everything. You're
well, I mean, yeah, but I mean, yes, it's part of the way that regulation was structured. Is that they can go and just request documents remotely. They don't need to be there.
Right. So you get a phone call from FDA that says, okay, we show that you're an importer of record for this product. Send us your hazard analysis.
And not only that, Bryan, the FDA recently released the, okay, so this is the website, the portal for people to report and send us the documents according to our request. That was already what was that, 5 months ago or something? It was recent.
Yeah. Yep. Absolutely.
And that portal was created for FSVP purposes.
Yep. And they're using it now. They are using it. So what's very interesting is then, so the next group under FSMA, right? So we have a long list now. So I've started the FSMA list, right? So we've got 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Just for FSMA. And really what's going on here is FDA is starting to develop some of the documents that they need to develop. So for example, when you look at, and let me grab the link for this and throw this in here.
While you look for that, let me give everybody, most likely you already know these guys, but I mean, a little bit of an introduction. When the FDA created the Preventive Control for Human Food class, they developed a manual. And beside the manual, there is a guidance document. There is a master document for the preventive controls. Yeah, okay. So that's a manual. Well, there is another document that accompanies that one. And that other document is called the guidance. That guidance has, I believe, is from chapter 1 to chapter, I'm going to guess 5 or 6 already developed.
Correct. Good.
But
Good.
all
Good
of
for
the
you.
other,
You got it. You got it right. I'm looking at it right now.
but all of the other chapters, okay, so we're working on it. And looks like they are going to be releasing some of those chapters right now.
Yep. So 1 through 6, you're absolutely right. So 7, 8, 9, 10, 11, 12, 13 are all under development. 14 is recall and 15 was supply chain. So now they're circling back and doing 7, 8, 9, 10, 11, 12. And that's what we're seeing in here. And additionally, and I'm not sure about this one, Jose, number 18 is Appendix 1, which is the potential hazards for foods and processes, is already in there, right? And we've been using that quite a bit. And that's a great reference, by the way, and a great resource for your food safety plan. Are they going back and updating it? Because they've received some criticism for it. So we'll see what happens on that. I bet they're going to update it. So
one thing that I noticed with that one, Brian, is that, for example, if you look at the 17 categories of food that they defined at the beginning, those 17 categories are basically the letters that are next to the tables. So table 1 is for biological hazards. Table 2 is for chemical hazards. Table 3 is for hazard related with the process.
Right.
Okay. So then you have table 1A, 1B, 1C, and so on until 1Q. The thing is that if you connect the tables with the categories at the beginning, there is a lapse because A, B, and C are in the right order as the tables, but I believe that is C or D that is skipped and is later, and there is a little bit of a disconnection there. 1 and 2. That remember that appendix number 1 is just a reference. You cannot say these are all the hazards that I may have, because if you go to the, for example, the hazards from the process in table 3, you have metal, but you don't have glass, and you don't have wood, and you don't have ceramics, and you don't have other things that, and those are things that may happen to each of you depending on your process and your equipment. Right. So the list is not all inclusive.
No. Yeah, and that's a good point. So to summarize that, is Appendix 1 is FDA's best guess of what you should be looking at.
Yes.
It may not apply to you.
Yes.
But you can bet, right? So back to our chocolate example. So salmonella in chocolate, known risk.
Yeah.
And it's well documented. There have been recalls, et cetera, et cetera, et cetera. If you have a chocolate product and FDA comes in and says, okay, well, on Appendix 1 here, we've got a hazard associated with chocolate as salmonella. Tell me about that, right?
Yeah. Yeah.
And it could be, okay, well, we control that here. We do this, that, and that. Or we control it through our supply chain preventive controls, and here's what we do with that.
Yeah.
But, or it may be that doesn't apply to us, right? And the FDA is going to say, okay, tell me more about that, right?
Yes.
So you have to be able to explain this always. And you hear me say this many times. You have to be able to tell your story. Just having documents is not enough.
Yes.
Jill has a good point here, or a good question. Can you give your thoughts on the vegetable recalls recently, like the prepared salads? Why does this keep happening?
Okay.
This has been going on a long time. And I mean, I'm not an insider on this, and Jose, you may have better insight than I do. But I mean, kind of the way I think of it is it's like, so with salad materials, lettuce and things like this, they're chopping it up. They're increasing the surface area.
Yes.
They're providing vectors for things to get in. And salmonella and stuff like this can get inside, right?
Yes.
And how do you chlorinate something if the pathogen is inside?
Yeah. Yeah.
Right. It's been something that industry, right? So you get this balance, right? People love the convenience, but it's risky.
Yes, it is.
When you come home and you eat a salad, you're completely reliant upon that manufacturer's control of those hazards because you're dumping it in a bowl and you're eating it.
Yes.
I haven't seen anybody microwave a salad. If they did, I wouldn't fricking eat it, right? So that's the trade-off, right? And it kind of gets to the overall topic for our conversation today, right? Which is we learn more and more all the time. And the challenges in that industry are huge. And right, we want to help them every way that we can, but they've got some challenges they need to figure out. So it's kind of a crappy answer, Jill, but that's kind of that's my take on it. So pork cleaning at the facilities and harvesting equipment from Francisco and Duncan said with salad, it's a high risk food because there's no kill step outside of chemical. There's no further processing like cooking. All right. So pretty much saying what we're saying, right? And part of this too, right, with chlorine, and this is what you see a lot in, like primary producer type issues is chlorine is very, very quickly inactivated by high loads of soil, right? So if you get something going through there and you're rocking along and you got your 200 ppm and something hits that system and it goes to zero, you don't even know, right? So FDA is focusing in on the Appendix 1, Chapter 11, Allergens, Chapter 16, validation. Oh, right. So we've talked about this before, validation and verification.
Yes.
How you set this up and you're verifying and you're checking, how do you know that time and temperature and caustic level and blah, 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 how do you validate that for your process?
How do you know that it's going to work?
Yeah, exactly.
What is the evidence?
Chapter 17, I think this is an interesting one too. Classifying food as ready to eat or not ready to eat, right? And that's very important.
That's going to be a good.
If you're a regional FDA director, right, you have resources that you need to allocate. And if you're sitting at that desk trying to figure out where to send your field inspectors, your investigators, you want to focus on higher risk things, right? And ready to eat is higher risk, right? There's nothing to protect, right? It's like the salad, ready to eat.
Yes.
So you want to focus on those industries. If it's not ready to eat, that's a lower priority. So they're going to distribute those resources accordingly. But I like this because what do they consider ready to eat, right? There's a lot of different things that go through processes that don't have a kill step, but still have other protections. So low water activity or things like this.
And I believe that it was already part of the law. FSMA law, I believe that there is a section there that requires the FDA to define what is ready to eat.
Yeah.
Don't quote me 100%, but I believe that it was there.
No, I think you're right. Acidified foods, Chapter 18. So that's going to be an important one, right? So pickles and all these type of things, right?
Yes.
You have to do that correctly. And accredited third-party audits, so setting up those laboratories for inspections. Refusal of inspection by foreign entities, right? So FDA goes in or someone goes in to audit and they say, you can't audit. What's going to go on with that? FSPP again, foreign supplier verification for importers of food for human products guidance, right? So we've seen FDA mention FSPP twice now. Recalls, Sprout, right? As we just talked about.
It's a concern, yeah.
And 3 around labeling, right? That finishes out FSMA. So as you can see within that FSMA area, FDA has a huge amount of work in front of them for that.
Yeah.
Right? Creating these guidance documents is very difficult. You have to create them and then you have to put them out for public comment and get feedback, right? There's a mechanism that FDA has to go through for this. So it's a lot of work. So I'm glad they're tackling this. So labeling of plant-based milks, right, as we talked about before. Labeling of plant-based alternative to animal-derived foods, right? Fake meat or what have you. Dietary guidance around labeling and draft guidance for industry for that too. So FDA's got a huge amount of work on their slate.
Yes,
2022.
Huge amount.
They will not get this done this year.
Well, you know what? Maybe they have been working on these for years, and maybe they just need to kind of tweak and send it out.
Yep. So hopefully, and we're already out of time, Jose.
Yes.
Luckily, we got through the list, so that's pretty good. But
that was quick.
But I tell you what, I would rather not finish the list and talk with the people who are with us and joining us and providing us amazing feedback.
Yes.
That's why we're here. So thank you, everybody. Amazing feedback. The conversations here And this is why we do what we do, right? To share information and knowledge and make food safer and better for everyone. So thanks again, everybody, for joining us today for this food safety chat. And as we often say on here, it's absolutely amazing how fast this time goes. And we appreciate it. And we appreciate you joining us every Friday for this. And with that, join us next Friday at the same time, right? We're here every Friday to have these type of discussions. If there's things you would like us to talk about, that's why we're here, right? We want to share our knowledge. Food safety is for everyone. Our emails are on here, right? And there's Jose's over there. And, email us, ask us questions, right? Renee is on LinkedIn. If you haven't already, friend Renee, he puts together these events, and then you can put it on your calendar to remind yourself that this is happening so that you're here, because being live it makes it so much cooler, right? And I love doing this. So thank you, my friend Jose. As always, amazing input. And thank you, everybody, for joining us. And we'll see everybody back here next Friday at the same time. So 8 a.m. Mountain Time, where I'm at, 10 a.m. Eastern, where Jose is in lovely, sunny Florida. And we'll continue on with our next topic around food safety. So in the meantime, enjoy your weekend. I hope it's a beautiful weekend where you're at. And it's going to be wonderful here in Colorado. So thanks again. And we will see you back here next week. All right. Thanks, everybody.
Bye.
Thanks, Jose.
Thank you.
Have a good one, everybody.